So today, we're going to break down what's really going on with the National Health Service. And it all kicked off with this incredible, powerful promise. I mean, think about it. Back in 1948, the whole idea of the NHS was so simple and revolutionary. Good healthcare should be there for everyone, no matter how much money you have. A real safety net from cradle to grave. Okay, so fast forward to today, and that promise, it feels like a lifetime ago, because this is the reality. Right now, over 7 million people in England are stuck on a waiting list for treatment. To give you some perspective on that, that's more than 1 in every 10 people. Just let that sink in. And here's the kicker, right? You pay for this service. We all pay for it. If you're a basic rate taxpayer, you're chipping in something like £3,000 to the NHS every single year. So the big question is, how on earth did we get from free healthcare for all to, well, this? Where is all that money actually going? Well, the answer, as it so often does, starts when you follow the money. So let's dig into one of the biggest and maybe quietest changes to the NHS over the last decade or so: privatization. And the scale of this, honestly, it's just staggering. Get this, since 2012, £10 million has been siphoned out of the NHS budget and handed straight to private companies as profit. Not for care, not for nurses, not for new equipment, for profit. And that's not a one-off, that's every single week. So you have to ask, how did this even become possible? Well, the real turning point was a piece of legislation called the Health and Social Care Act back in 2012. It totally rewrote the rulebook. Before this act, the health secretary had a legal duty to provide health care for everyone in England. This law, it scrapped that duty. And just like that, the floodgates were thrown open for private companies to start bidding on NHS contracts. And the results were, well, pretty much immediate and dramatic. So before this law, back in 2011, private companies were treating only about 3% of NHS patients. But today, that number has more than tripled. It's now 10%, and it's still climbing. This isn't an accident. It's a huge, deliberate shift of our public services into private hands. And we're not talking small-scale stuff here. This outsourcing is on a colossal scale. Right now, there are something like 59,000 separate private contracts operating inside the NHS, and the annual cost? A mind-boggling £29 billion. That is nearly a fifth, 1/5, of the entire NHS budget just being funneled directly to private companies. But you know, privatization is only one piece of the puzzle. There's an even deeper, sneakier financial black hole that's been draining money from patient care for decades.